Ladies and gentlemen, most people think a stroke arrives without warning. One moment you are living your normal life, and the next, everything changes forever. That is what millions of people believe. In fact, many people are told that strokes happen suddenly, randomly, almost like lightning striking from nowhere. But what if I told you that for many people, the body begins whispering a warning nearly a full day before the attack actually happens? And even more shocking, what if those warnings are often ignored because they seem too small, too temporary, or too strange to be dangerous? Tonight, I want you to stay with me very carefully because what researchers and neurologists have discovered over the past decade is changing how we understand strokes entirely. The human brain does not usually go silent without first sending distress signals. Tiny clues begin appearing in the eyes, in the skin, in balance, in speech, even in the way a person walks across a room. And the tragedy is that many people brush these symptoms away as fatigue, stress, aging, or just one of those days. Then, hours later, they're sitting in an emergency room, unable to move one side of their body, unable to speak clearly, or fighting for their life. And this becomes even more important after the age of 40, because once we cross that age, the blood vessels feeding the brain begin changing in ways most people never feel happening. High blood pressure silently weakens artery walls. High blood sugar quietly scars delicate blood vessels. Smoking thickens the blood and inflames the lining of arteries. Irregular heart rhythms can send tiny clots floating toward the brain without warning. The frightening part is that these problems often build silently for years before a major stroke finally appears. But the body often tries to warn us first. I remember a patient named Margaret, 74 years old, from Florida. She told me she woke up one morning and noticed something strange while pouring her coffee. The vision in her right eye became blurry for about 3 minutes, almost like someone had smeared grease across her glasses. Then it disappeared completely. She felt normal again. No pain, no weakness, no dramatic collapse. So she ignored it. Later that afternoon, she noticed her left hand felt slightly numb while holding her phone. Again, it vanished within minutes. By evening, she was walking through her kitchen when she suddenly lost balance and had to grab the counter. Her daughter begged her to go to the hospital, but Margaret said something heartbreaking that doctors hear every day. If it was serious, it wouldn't keep going away. The next morning, Margaret suffered a massive stroke. Stay with me because this is where things become frighteningly important. Many strokes do not begin with catastrophe. They begin with temporary interruptions of blood flow called TIAs, or transient ischemic attacks. Some people call them mini strokes, but that name can actually be dangerous because it makes them sound harmless. They are not harmless. A TIA is often the brain's final warning shot before a major stroke arrives. Blood flow to part of the brain becomes blocked briefly, then returns. Symptoms may last only minutes, sometimes less than 5 minutes. Then everything feels normal again. But what shocked researchers was what happened afterward. Studies from major stroke centers found that the risk of a major stroke becomes extremely high during the next 72 hours after a TIA. Not weeks later, not months later, sometimes just hours later. This changes everything about how we should respond to strange neurological symptoms, because the disappearance of symptoms does not mean the danger is gone. In many cases, it means the countdown has already started, and here is what most people never realize. The brain itself cannot feel pain the way skin or muscles can. So, when blood vessels inside the brain begin struggling, the warnings can appear in strange, subtle ways instead of dramatic pain. Sometimes the first sign is sudden blindness or blurry vision in one eye. It may feel like a curtain briefly dropping over the eye. Other times, words suddenly become difficult to form. A person may know exactly what they want to say but cannot get the words out correctly. Some people suddenly sound confused or slur their speech for only a few moments. Then they recover. Others experience a strange numbness or tingling on one side of the body that disappears before they even decide to call a doctor. And this is where many families make a fatal mistake. They wait. They wait because the symptoms improved. They wait because the person says they feel embarrassed. They wait because they assume it was low blood sugar, dehydration, anxiety, or exhaustion. But every minute during a stroke matters because brain cells begin dying rapidly when deprived of oxygen. Researchers often use the phrase, time is brain, because millions of neurons can die within minutes during a severe stroke. That is not just medical terminology. That is memory. That is speech. That is movement. That is personality. That is independence. Let me ask you something. Have you or someone you love ever suddenly felt dizzy, confused, numb, or unable to speak clearly for a few minutes, and then felt completely normal afterward? If so, I want you to remember this conversation tonight, because your body may have already tried to warn you. Now, among all the warning signs doctors fear the most, one of the earliest and easiest to miss is sudden vision change. Many people assume a stroke must begin with paralysis, but sometimes the very first symptom appears in the eyes. One eye suddenly becomes blurry, vision dims temporarily. Some people lose half their visual field without realizing it immediately. Why does this happen? Because the arteries feeding the eyes and the brain are deeply connected. A tiny clot or narrowed blood vessel can briefly interrupt circulation to the retina or visual centers of the brain before restoring itself. The symptom fades, but the danger remains. One patient told me it felt like a gray cloud drifting across one eye. Another said she thought her contact lens had dried out. Another blamed allergies. But what makes this so dangerous is how quickly normal vision often returns. The brain almost tricks people into feeling safe again. And then comes another symptom that many families mistake for aging: balance problems. A person suddenly walks strangely, almost like they are drunk. They veer to one side. They stumble unexpectedly. They feel disconnected from their own movement. This happens because areas deep in the brain controlling coordination and spatial awareness begin losing oxygen. Sometimes it lasts only moments, but those moments matter. And this is where things become fascinating. Researchers discovered that some people experience these warning signs in clusters. First vision changes, then numbness, then confusion, then balance problems. The symptoms may appear separately over several hours, making them seem unrelated, but together they can paint the picture of a brain struggling to maintain blood flow. I want you to picture the blood vessels inside your brain like an intricate highway system carrying oxygen every second of your life. When those highways become narrowed by high blood sugar, inflamed by smoking, weakened by blood pressure, or blocked by tiny clots, the brain begins sending distress signals. The tragedy is that modern life trains people to ignore their body. We normalize fatigue. We normalize dizziness. We normalize numbness. We normalize confusion, and sometimes that normalization becomes deadly. But there is another warning sign that surprises many people even more. Some individuals experience unusual headaches before a stroke, especially if they rarely get headaches normally. Not every headache means danger, of course, but a sudden, unusual headache combined with neurological symptoms can become an important clue. Some researchers are even investigating links between autoimmune inflammation, skin conditions like vitiligo, and increased vascular risk because chronic inflammation may affect blood vessel health throughout the body. This is why stroke prevention is not just about cholesterol anymore. That old belief is incomplete. Here is what many people never hear clearly enough. Strokes are often about damage inside the blood vessels themselves. Fragile vessel walls, inflamed arteries, thickened blood, sugar-damaged circulation, silent injury accumulating year after year until one day the brain can no longer compensate. And in the next part of this discussion, I'm going to show you the hidden reasons some people are far more vulnerable than others, including the dangerous connection between diabetes, smoking, atrial fibrillation, and silent vessel damage that can increase stroke risk dramatically even before symptoms appear. We'll also talk about the critical 72-hour window after a mini stroke, the medical tests that can reveal hidden danger, and the mistake many people make with blood thinners that can become catastrophic if handled incorrectly. One of the most dangerous myths in modern medicine is the belief that strokes only happen to unhealthy people. Many viewers watching tonight probably know someone who looked completely normal on the outside, someone who still walked every day, still drove their car, still laughed with family at dinner, and then suddenly suffered a devastating stroke that changed everything overnight. And what shocked researchers is that many of these individuals had been carrying silent blood vessel damage for years without realizing it. This is where I want you to think differently about stroke risk, because the real danger often begins long before the clot forms. It begins inside the delicate inner lining of your blood vessels. Imagine the arteries feeding your brain as smooth, flexible tunnels carrying oxygen-rich blood every second of your life. When those vessel walls are healthy, blood flows smoothly. But high blood sugar, smoking, chronic inflammation, and high blood pressure slowly scratch, inflame, and weaken those inner surfaces. Tiny injuries begin forming. Plaque becomes unstable. Blood becomes stickier. Circulation becomes turbulent instead of smooth. And eventually, a clot can form or travel upward into the brain. This is why diabetes has become one of the most feared stroke risk factors in the world. Not simply because of high sugar, but because elevated glucose acts almost like microscopic shards of glass scraping against the blood vessels over time. Researchers from major cardiovascular institutes found that people with diabetes can face dramatically higher stroke risk because chronically elevated blood sugar damages the vascular system silently for years before symptoms appear. And what makes this even more frightening is that many people already have prediabetes without knowing it. Stay with me, because this changes everything about how we think of prevention. Many people assume they would feel diabetes developing. but some never notice obvious symptoms. Meanwhile, inside the body, excess glucose is quietly stiffening arteries, increasing inflammation, and weakening circulation to the brain. I once treated a man named Richard, 62 years old, who told me he felt perfectly healthy except for occasional fatigue after meals. He thought aging was slowing him down. Then one afternoon, while speaking to his grandson, he suddenly could not finish a sentence. The words became scrambled. His right arm felt heavy. Within minutes, the symptoms disappeared. Richard nearly stayed home, but his daughter forced him to go to the emergency room. Doctors discovered he had experienced a TIA caused by severe narrowing in his carotid artery, the major blood vessel carrying blood to the brain. His blood sugar levels were dangerously elevated, and he had no idea. 3 days later, surgeons told him something chilling. If he had ignored that warning episode, there was a very high chance he would have suffered a major stroke within days. I want you to remember this because the body often whispers before it screams. And then there is smoking. Even now, millions of people still think about smoking mainly in terms of lung disease, but neurologists fear smoking for another reason entirely. Smoking changes the blood itself. Chemicals from cigarettes inflame artery walls, increase clot formation, reduce oxygen delivery, and make blood thicker and more unstable. Over time, this creates the perfect environment for stroke. What shocked researchers was how quickly stroke risk can begin improving after quitting. The body desperately wants to heal when given the chance. But perhaps the most underestimated danger of all is high blood pressure. This is the silent destroyer neurologists worry about every single day because hypertension weakens arteries gradually without causing pain. Many people walk around with dangerously high blood pressure for years while feeling completely fine. Yet with every heartbeat, excess pressure pounds against fragile vessel walls deep inside the brain. Tiny weaknesses begin forming. Arteries stiffen, some eventually rupture. Others narrow until blood flow becomes critically compromised. And here is where things become emotionally difficult for many families. The symptoms before a stroke can be so subtle that loved ones doubt themselves. A husband suddenly forgets words for a minute. A mother seems briefly confused while talking on the phone. A grandfather stumbles walking down the hallway. Then the episode disappears. Everyone relaxes. Life moves on. But inside the brain, the warning may already have been delivered. So let me ask you something. If your body gave you a brief warning today, would you recognize it? Because the next group at especially high risk may surprise you even more. People with atrial fibrillation, often called AFib, carry one of the highest stroke risks in medicine. AFib is an irregular heartbeat that causes blood to swirl abnormally inside the heart chambers. When blood stagnates, clots can form. Those clots may then travel directly into the brain. Some people feel AFib as fluttering in the chest. Others feel nothing at all. That is what makes it so dangerous. I remember a woman named Eleanor, 71 years old, who described occasional episodes where her heart felt like a fish flopping inside her chest. She ignored it for years because the sensation always stopped eventually. Then one morning she lost vision in her left eye for about 4 minutes. By the time she reached the hospital, her vision had returned completely. Tests revealed intermittent atrial fibrillation. Doctors later told her that tiny clots from her heart were likely traveling toward her brain. Eleanor was lucky, very lucky, because many people never receive that second chance. And this is why proper testing matters so much after any suspected warning sign. One of the most important tests doctors use is a carotid ultrasound, which checks for dangerous narrowing in the neck arteries supplying the brain. Another critical test is the HbA1c blood test, which reveals average blood sugar levels over several months instead of just one moment in time. This can uncover hidden diabetes or prediabetes silently damaging blood vessels. And for detecting irregular heart rhythms, doctors often use Holter ECG monitoring, which records the heart continuously over 1 or more days because abnormal rhythms can come and go unpredictably. Now here's something incredibly important that every viewer needs to hear. Never assume all strokes are treated the same way. Some strokes happen because of blocked blood vessels. Others happen because of bleeding inside the brain. And this is why taking blood thinners without proper medical evaluation can become extremely dangerous. If someone has bleeding in the brain, inappropriate blood thinning could worsen the situation catastrophically. That is why emergency brain imaging is essential. Doctors must identify exactly what type of stroke is occurring before treatment decisions are made. This is not the moment for guesswork. This is the moment for emergency action. And yet, despite everything we know medically, one emotional barrier still prevents many people from seeking help quickly: denial. People are afraid of hospitals, afraid of hearing bad news, afraid of making a fuss over symptoms that disappeared. But what researchers discovered is heartbreaking. Many stroke patients experienced warning symptoms beforehand and simply waited too long to act. The next 72 hours after a TIA can become a race against time. I want you to picture this carefully. A tiny clot temporarily blocks blood flow. Symptoms appear. Then the clot shifts or dissolves, restoring circulation. The person feels normal again, but the unstable condition causing the blockage may still exist. Another clot can form, another blockage can occur, and the next one may not disappear. This is why emergency physicians take transient symptoms so seriously. Even if you feel better, even if symptoms lasted only minutes, even if your family thinks you look completely normal afterward. And this is where the emotional side of stroke prevention becomes so powerful. Because prevention is not about fear alone, it is about protecting moments that matter. Conversations with grandchildren, walking independently, reading a book, recognizing loved ones, speaking clearly, living with dignity and freedom. Researchers increasingly believe that the earlier people control blood sugar, blood pressure, smoking, inflammation, and heart rhythm problems, the more brain tissue can potentially be protected over time. Those are not small improvements. Those are life-changing protections. And in the next part of this documentary, I'm going to show you the warning signs many people still dismiss as normal aging, the surprising connection between inflammation and vascular damage, and the practical steps neurologists want every person over 40 to begin taking immediately to reduce stroke risk dramatically before symptoms ever appear. There is a moment that neurologists talk about quietly among themselves, a moment families rarely see coming until it is too late. It is the moment when years of silent blood vessel damage finally overwhelm the brain's ability to adapt. And what makes this so tragic is that many people were never truly fine beforehand. The warning signs were there, the circulation problems were there, the inflammation was there, but modern life taught them to ignore the signals because they did not seem dramatic enough to matter. This is where things become deeply important for anyone over the age of 40, because aging itself changes the blood vessels. Arteries gradually lose flexibility, tiny injuries accumulate over decades, and when conditions like diabetes, smoking, high blood pressure, obesity, chronic stress, autoimmune disease, or irregular heartbeat are added into the picture, the brain begins operating with less and less reserve. Researchers sometimes describe it as a city surviving on damaged highways. Traffic still moves until one critical road suddenly closes. And here's what most people never realize about stroke symptoms. The brain region affected determines the warning signs. If blood flow is interrupted near the speech centers, words suddenly become difficult. If balance centers lose oxygen, walking becomes unstable. If vision pathways are affected, eyesight may dim or disappear temporarily. If circulation problems affect the sensory cortex, numbness and tingling can spread across one side of the body. But because these episodes can be brief, people rationalize them away. A retired teacher named Daniel once told me something I have never forgotten. He said, "I thought I was just tired." Daniel was 68 years old and had high blood pressure for years. One evening during dinner, his wife noticed he kept using the wrong words while speaking. Instead of saying glass, he called it a window cup. Instead of phone, he said television thing. Everyone laughed nervously because he seemed otherwise normal. 10 minutes later, his speech returned completely. Daniel insisted nothing was wrong. The next afternoon, he suffered a major stroke that left his right side partially paralyzed. Stay with me because this is where the story changes from fear to empowerment. The remarkable truth is that many strokes are preventable when the warning signs are recognized early enough. The brain is incredibly resilient when given support before catastrophic damage occurs. And one of the most powerful protections begins with understanding vascular health rather than focusing on a single number like cholesterol alone. For decades, many people believe strokes were caused almost entirely by cholesterol buildup. But vascular specialists now understand the situation is much more complex. A person can have normal cholesterol, yet still carry severe stroke risk because the true issue often involves inflammation, unstable plaque, blood vessel injury, clotting tendency, and metabolic dysfunction. This is why high blood sugar matters so much, why smoking matters so much, why uncontrolled blood pressure matters so much. These conditions attack the blood vessels themselves, and this is where autoimmune conditions enter the conversation in a fascinating way. Researchers have discovered that chronic inflammation associated with autoimmune diseases may increase vascular damage throughout the body. Conditions involving immune dysfunction can inflame arteries and alter blood vessel behavior over time. Even skin conditions linked to immune activity, such as vitiligo, are being studied more closely because they may reflect broader inflammatory processes happening internally. Now, this does not mean everyone with autoimmune disease will suffer a stroke. Not at all. But it does remind us that inflammation inside the body is never just skin deep. What shocked researchers in several vascular studies was how strongly lifestyle changes influence stroke risk reduction, not perfection. not extreme diets, not impossible routines. Consistent improvements. When blood pressure is lowered, blood vessels experience less mechanical stress. When blood sugar stabilizes, artery damage slows. When smoking stops, inflammation begins decreasing surprisingly quickly. When atrial fibrillation is diagnosed and treated appropriately, dangerous clot formation can often be reduced dramatically. These are not small changes. These are the kinds of changes that preserve brain function, memory, movement, and independence. I remember another patient, Gloria, 73 years old, who arrived terrified after experiencing temporary numbness on the left side of her face while gardening. By the time she reached the hospital, the numbness had vanished. But unlike many people, Gloria did something critical. She acted immediately. Doctors performed imaging, discovered severe carotid artery narrowing, and identified uncontrolled diabetes she never knew she had. She later told me something emotional. She said, "That 5 minutes of numbness may have saved my life." Think about that. Sometimes the warning itself becomes the opportunity. And this is why I want every viewer listening right now to remember the fast warning system neurologists teach worldwide. Face drooping, arm weakness, speech difficulty, time to call emergency services. But beyond fast, I also want you to remember the quieter symptoms people overlook: sudden blurry vision, temporary confusion, strange imbalance, brief numbness, unusual headaches, sudden difficulty understanding words, or episodes that feel almost dreamlike and then disappear. Your body is not trying to annoy you. It may be trying to protect you. Now let us talk about one of the most dangerous emotional reactions after warning symptoms: embarrassment. Many older adults tell themselves they do not want to bother family members or emergency doctors if symptoms improve, but emergency physicians would much rather evaluate a false alarm than lose precious treatment time during a real stroke, because timing changes outcomes dramatically. When stroke treatment begins quickly, some patients recover astonishing amounts of function, but delayed treatment can allow irreversible brain injury to spread. That is why neurologists become deeply concerned about people who wait overnight after symptoms appear. Some wait because they hope things will improve. Others sleep through warning signs. Others convince themselves they are overreacting. And this is where loved ones become critically important. Family members often notice stroke symptoms before patients do: slurred speech, uneven smiles, confusion, personality changes, strange walking patterns. If you see these signs in someone you love, do not wait for symptoms to come back. Act immediately. So let me ask you something tonight. If your spouse suddenly struggled to speak for 3 minutes and then recovered completely, would you still call emergency services? Or would you assume everything was fine? That question could one day save a life. And now we arrive at one of the most hopeful parts of this entire discussion. The brain has an extraordinary ability to protect itself when circulation improves and risk factors are controlled early enough. Many people think stroke prevention becomes pointless after a certain age, but research repeatedly shows meaningful benefits even later in life. Better blood pressure control reduces stroke risk. Improved diabetes management helps protect blood vessels. Quitting smoking improves circulation. Detecting a regular heartbeat prevents clots. Small daily choices accumulate just like small daily damage once did. This is why prevention is not about fear of dying. It is about preserving the life you still want to live, walking independently into your kitchen, remembering your children's names clearly, holding a conversation, reading your favorite book, traveling, laughing, cooking, living without dependence. And in the final part of this documentary, I'm going to show you what neurologists and stroke specialists most want families to understand during those critical warning hours before a stroke, the exact emergency mindset that saves lives, and the hopeful truth about how awareness alone can change the future for someone you love. Thanks for watching.